I'm Katherine, 34, a hospital social worker who believed in the sacred trust between patients and their caregivers. When my husband went in for routine gallbladder surgery, I kissed him goodbye with complete confidence. After all, I worked in this very hospital. But as they wheeled his lifeless body past me 3 hours later, a young nurse's trembling whisper shattered my world: "Wrong patient." The medical error that stole my husband's life was just the beginning. What I uncovered about the systematic cover-ups, the falsified records, and the lengths they'd go to silence me would expose a conspiracy that reached the highest levels of hospital administration. If you've ever trusted the system only to be betrayed when you needed it most, like and subscribe for a story of devastating loss, relentless pursuit of truth, and the justice that comes when love refuses to stay silent. The world stopped moving when those words hit me. Wrong patient. I stood frozen in the hospital corridor where I'd walked confidently for 6 years, where I'd helped countless families navigate their darkest moments. Now I was the one drowning. My legs gave out first. The cold linoleum floor pressed against my knees as I collapsed, the surgery schedule board blurring through my tears. There, in black marker, was his name, scheduled for gallbladder removal at 9 a.m. Such a routine procedure. We joked about it over breakfast, him complaining about the pre-surgery fasting while I assured him he'd be home by dinner. Dr. Morrison, the chief of surgery, appeared beside me with practiced sympathy. His words felt rehearsed, clinical. "Katherine, I'm deeply sorry for your loss. These things happen sometimes in medicine. We'll conduct a full review. These things happen." As if my husband's life was just another statistic, the death certificate draft they handed me an hour later made my blood run cold. Cause of death: complications during surgical procedure. No mention of the mix-up. No acknowledgement of the error that killed him. Just sanitized medical language that told me everything I needed to know about what came next. The nurse who'd whispered the truth was nowhere to be found. When I asked about her, the floor supervisor claimed not to know who I meant. "We had several nurses in surgery today, Mrs. Katherine. You must be confused in your grief." But I wasn't confused. I was a social worker. I knew evasion when I heard it. The way the staff avoided my eyes, the hushed conversations that stopped when I approached. The sudden formality from colleagues who'd shared coffee with me just that morning. They were already circling the wagons. By evening, when I finally made it home to our empty house, 3 things were clear: my husband was dead from a preventable error, the hospital was already covering it up, and I was completely alone in a fight I didn't yet understand how to fight. I sat in his chair, holding the sanitized death certificate, and felt something harder than grief settle in my chest. They thought they could bury this mistake along with my husband. They were wrong. I couldn't sleep that first night. Every time I closed my eyes, I saw his face when they wheeled him into surgery, calm, trusting, completely unaware he'd never wake up. By 3 a.m., I was back at the hospital, using my badge to access areas I normally wouldn't enter. The surgical wing felt different in the pre-dawn darkness. Empty gurneys lined the hallways like ghosts, and the only sound was the hum of fluorescent lights. I made my way to the scheduling office, my heart pounding as I pulled up the day's surgical roster on the computer. There it was, my husband's name at 9 a.m. for laparoscopic gallbladder removal. But something else caught my eye: another patient. Scheduled for the same time slot in the adjacent operating room. The name was eerily similar, just 2 letters different. Same first name, similar last name, same age bracket. My hands shook as I cross-referenced their medical records. The other patient, the one who should have died, had been scheduled for emergency brain tumor removal. A procedure with significant risks, one that carried a high mortality rate even under the best circumstances. In the recovery room, I found what confirmed my worst fears: 2 patient wristbands in the medical waste bin, not yet disposed of. The printing was smudged on both. The room numbers barely legible. In the chaos of a busy morning, someone had simply grabbed the wrong chart, the wrong patient, sent the wrong man to die. The tragic irony hit me like a physical blow. The other patient, the one who actually needed brain surgery, had received my husband's simple gallbladder procedure. He was recovering upstairs, completely unaware that his survival had cost another man his life. Meanwhile, my healthy husband had been subjected to an unnecessary craniotomy that his brain couldn't survive. I stood there holding those wristbands, too Pieces of plastic that represented the difference between life and death, between justice and cover-up. This wasn't a complication during surgery. This wasn't one of those things that happens in medicine. This was negligence, pure and simple. Someone had been too careless, too rushed, too indifferent to double-check a name, but what made it criminal was the lie they'd already begun telling. The death certificate listed surgical complications, not wrong patient surgery. They were going to let the world believe my husband died from his own condition, not their mistake. I photographed the wristbands with my phone, my evidence of the truth they wanted buried. Then I sat in that empty recovery room and made a promise. To my husband and to myself, they would not get away with this. No matter what it cost me, no matter who tried to stop me, the truth would come out. The hospital had made their first mistake when they killed him. But their second mistake, thinking they could silence me, would prove far more costly. Monday morning brought the full weight of institutional machinery to bear. I arrived at work to find my computer access suspended for routine security updates. My badge no longer opened certain doors. Colleagues who had hugged me at the funeral now offered tight smiles and hurried past. The incident report I tried to file disappeared from the system 3 times. Each time, I was told it was a technical glitch that would be resolved soon. When I finally cornered the risk management director, he handed me a heavily redacted document that revealed nothing about what actually happened. "Katherine, we understand. You're grieving," he said, his voice dripping with false compassion. "But sometimes in our pain, we look for someone to blame. The preliminary investigation shows this was an unfortunate but unavoidable complication." Unavoidable. I stared at the redacted form where entire paragraphs had been blacked out. Whatever this document originally said, it wasn't what I was seeing now. The hospital's legal team materialized like vultures. 3 lawyers and expensive suits cornered me during my lunch break, offering their condolences while making it clear that any premature statements about the incident could be harmful to everyone involved. They spoke in careful legal language about ongoing investigations and patient privacy and the healing process. But their message was crystal clear: stay quiet, or face the consequences. My supervisor, Janet, called me into her office that afternoon. We'd worked together for 4 years, shared countless difficult cases, supported each other through professional challenges. Now she couldn't meet my eyes. "Katherine, I've been asked to suggest you take extended bereavement leave," she said, shuffling papers nervously. "The hospital feels it would be best for everyone if you had time to process your grief away from triggers." "Triggers like the truth? Katherine, please. Don't make this harder than it has to be. You know how these things work. The hospital has resources, lawyers, procedures. Fighting them won't bring him back." That evening, I discovered my keycard access had been further restricted. I couldn't enter the surgical wing, the medical records department, or even the staff break room where I'd eaten lunch for 6 years. They were systematically cutting me off from any source of information or support within the building. The message from Human Resources arrived in my work email before I left: "Due to your current emotional state and recent family tragedy, we're implementing temporary restrictions on your access to patient information systems. This is for your own protection and to ensure patient confidentiality during this difficult time." Protection. Confidentiality. They wrapped their silencing tactics in concern for my well-being, but the intent was unmistakable. They wanted me isolated, voiceless, dependent on their version of events, but they'd underestimated something crucial about me. I'd spent 6 years as a social worker, fighting for families against institutions that wanted to sweep problems under the rug. I knew how these systems worked, how they protected themselves, how they tried to wear down anyone who threatened their carefully constructed narratives. They thought grief would make me compliant. Instead, it was making me dangerous. The note appeared in my car 3 days later, slipped under the windshield wiper while I was inside the grocery store. My heart raced as I unfolded the small piece of paper with its carefully printed message: "Coffee shop on Elm Street. Thursday. 7 p.m. Come alone. A friend who told you the truth." I recognized her immediately when I walked into the small cafe. The young nurse from that horrible day sat in a corner booth, her hands wrapped around a coffee cup like it was an anchor. She looked exhausted, her eyes darting nervously toward the door every few minutes. "I'm Rebecca," she said as I sat down. I've been a surgical nurse here for 2 years. I was in or 3 when. She trailed off, unable to finish. When they killed my husband, I finished for her, she nodded, tears forming in her eyes. I tried to stop it. When I realized we had the wrong patient, I spoke up. But Dr. Morrison said the surgery was already underway, that stopping would be more dangerous than continuing. He said we'd sort it out afterward. My blood turned to ice. They knew. During the surgery, they knew they had the wrong patient and continued anyway? The anesthesia was already administered. Your husband was unconscious. Dr. Morrison made the call to proceed with the brain surgery rather than wake him up and start over. He said the liability would be less if we just completed the procedure and dealt with the paperwork later. The full horror of what she was telling me sank in. This wasn't just a mix-up, this was a calculated decision to continue operating on my husband's brain rather than admit the error and potentially save his life. After your husband died on the table, Dr. Morrison called an emergency meeting. He told everyone in that room that if word got out about the mix-up, the hospital could lose its accreditation. People would lose their jobs. Families would lose their insurance. He made it sound like staying quiet was the noble thing to do. Rebecca pulled out her phone and showed me a photo she'd taken of the original incident report before it was altered. The document clearly stated wrong patient surgery and patient identification failure as contributing factors to the death. This is what they're hiding, she said. They rewrote the entire report. Made it look like a standard surgical complication. I kept this photo because I knew someone needed to know the truth. I stared at the image, feeling a mix of gratitude and rage. This young woman had risked her career to preserve evidence of the hospital's cover-up. Why are you telling me this now? I asked. Because I can't sleep. Because every time I go into surgery, I think about your husband and how we failed him. Because Dr. Morrison pulled me aside yesterday and offered me a promotion to day shift supervisor if I demonstrated my commitment to the hospital team. She looked directly at me. He's trying to buy my silence. And the other people in that room? Most are too scared to speak up. They have mortgages, kids in college, parents in nursing homes. The hospital knows exactly how to pressure people. She leaned forward. But there are a few others who feel like I do. Who think someone should pay for what happened. Rebecca slid a folded piece of paper across the table. These are the names of the other staff members who were in that meeting. Not all of them will talk, but some might. If you're really going to fight this, you'll need allies inside the hospital. As I left the coffee shop that night, I felt the first spark of hope I'd experienced since my husband's death. I wasn't alone in this fight. The truth had witnesses, and some of them were willing to stand up, but I also understood the magnitude of what I was facing. This wasn't just medical malpractice, this was institutional conspiracy. They hadn't just killed my husband through negligence, they'd made a conscious choice to let him die rather than admit their mistake. The war for justice was about to begin. Armed with Rebecca's information and the list of potential allies, I began my systematic investigation. My restricted hospital access had one major oversight: they'd forgotten about the medical records database I could still access from home. Through the employee portal, working late into the night, I pulled every document related to my husband's case. What I found made my hands shake with rage. The medical records told 3 different stories, depending on when they were created. The original admission record, timestamped at 8:47 a.m., clearly listed my husband for gallbladder surgery. But the surgical notes, supposedly created during the procedure, described a patient presenting with brain tumor symptoms. The post-operative report, dated 2 hours after his death, mysteriously aligned with the surgical notes, as if he'd been admitted for brain surgery all along. Someone had gone into the system and systematically altered his medical history to match the surgery that killed him. I documented everything, taking screenshots before they could disappear. The metadata told its own story. Multiple users had accessed and modified these records in the 48 hours following his death. Dr. Morrison's login appeared repeatedly, along with 2 administrators from the legal department, but the smoking gun came when I cross-referenced the other patient's records. The man who'd survived because he received my husband's simple gallbladder procedure instead of his own risky brain surgery. His original charts showed he'd been scheduled for emergency craniotomy, but those records had been altered too. Now they indicated he'd been admitted for gallbladder problems. They'd essentially swapped the two men's entire medical histories in the computer system. I printed everything before my access could be revoked, creating a paper trail that documented the systematic falsification of medical records. But I needed more than digital evidence. I needed witnesses who could testify to what really happened. Using Rebecca's list, I began reaching out to the staff members who'd been in that emergency meeting. Most wouldn't talk to me. A few hung up the phone the moment I mentioned my husband's name. But one surgical technician agreed to meet me in a parking garage downtown. "They're scared," he told me. After that meeting, everyone got called into individual sessions with human resources. They were told that discussing confidential medical information with unauthorized persons could result in immediate termination and potential criminal charges for HIPAA violations. "But this isn't confidential medical information," I protested. "This is evidence of malpractice and cover-up. Try telling that to someone with 3 kids and a mortgage." The hospital's lawyers are very good at making people believe they'll lose everything if they speak up. He handed me a flash drive. But some of us made copies of things before they were changed. Files, emails, scheduling records. We figured someday someone might need proof of what really happened. That night, I went through the contents of the flash drive. It contained original surgical schedules, unaltered incident reports, and most damning of all, email exchanges between Dr. Morrison and the hospital's chief administrator discussing damage control strategies, within hours of my husband's death. One email, sent at 11:32 p.m. on the day he died, was particularly chilling. "Legal advises we proceed with standard narrative. Surgical complication, no institutional fault. Records have been adjusted accordingly. All staff briefed on confidentiality requirements." They'd planned the cover-up before his body was even cold, but as I read through more documents, I realized this went deeper than one incident. There were references to a protocols committee that handled difficult cases, mentions of previous narrative adjustments, and staff compliance measures. My husband's death wasn't an isolated cover-up, it was part of a systematic approach to hiding medical errors. I now had documentary evidence of fraud, conspiracy, and institutional corruption. But I also understood why people were afraid to speak up. The hospital wasn't just an employer, it was the largest institution in our town, with connections to banks, law firms, and local government. Taking them on meant taking on an entire power structure. As I organized my evidence into files, preparing for the legal battle ahead, I thought about my husband's trust in this place, in these people. He'd gone to sleep believing he was in good hands, never knowing he was about to become collateral damage in an institution more concerned with protecting itself than protecting patients. They'd counted on my grief making me compliant, my isolation making me weak. Instead, they'd given me a mission that would consume every waking moment until justice was served. The statistics report I discovered buried in the hospital's internal database changed everything. Hidden in the administrative files was a quarterly mortality review that painted a disturbing picture of the institution I'd trusted with my life. And my husband's. The surgical department showed mortality rates 23% higher than state averages. The emergency department had twice the national rate of unexpected outcomes. But most telling were the incident reports, dozens of cases where clerical errors, communication failures, and protocol deviations had resulted in patient harm or death. None of these statistics appeared in the hospital's public reporting. None were mentioned in their marketing materials about their award-winning patient care. The document was marked internal use only, not for public distribution. I cross-referenced the dates with local obituaries and began to see a pattern that made me sick. Mrs. Franklin, 67, who died from complications during routine hip surgery, but the incident report noted she'd been given medication meant for a different patient. Mr. Chen, 42, who'd suffered unexpected cardiac arrest during outpatient procedure. The internal notes mentioned equipment malfunction that hadn't been reported to manufacturers. For every public story of medical complications and unfortunate outcomes, there was a hidden story of preventable errors and systematic cover-ups. I started reaching out to these families, introducing myself as someone who understood their loss. Most hung up or politely declined to talk. But a few agreed to meet with me, and their stories were heartbreakingly familiar. Jenny Rodriguez had lost her mother to what the hospital called postoperative infection. But Jenny had questions about why her mother, who'd been scheduled for a simple procedure, had been given a surgery intended for someone else. The hospital's patient advocate had convinced her that fighting would be too expensive and emotionally draining. Thomas Blake's father had died during what should have been routine cataract surgery. The hospital blamed it on previously undiagnosed heart conditions, but Thomas had medical records showing his father's heart was perfectly healthy. When he'd tried to investigate, the hospital's lawyers had threatened him with harassment charges. Each family had been isolated, made to feel like their loved one's death was an isolated tragedy, a 1 in a million complication. None of them knew about the others. None of them understood they were part of a larger pattern of institutional negligence. I began building a database of these cases, documenting the real stories behind the hospital's sanitized public reports. What emerged was a picture of an institution that had learned to manage medical errors not by preventing them, but by hiding them. The hospital had developed a sophisticated system for containing damage. First, isolate the families, making them feel alone in their grief. Second, overwhelm them with legal complexity and financial threats. Third, offer just enough settlement money to secure silence without admitting fault. Finally, alter records and control narratives to prevent any pattern from emerging. But they'd made one crucial mistake with my case. They'd targeted someone who worked inside the system, someone who understood how institutions operated and how they could be challenged. I contacted an investigative journalist at the state newspaper, someone known for exposing healthcare corruption. When I showed her my evidence, the altered records, the hidden statistics, the pattern of covered-up deaths, her eyes widened with recognition. "Katherine, what you've uncovered here isn't just about your husband," she said. "This is about public health and safety. If this hospital is systematically hiding medical errors, patients are dying unnecessarily because lessons aren't being learned, procedures aren't being improved." She agreed to investigate further, but warned me about the challenges ahead. Hospitals have armies of lawyers and public relations experts. They'll try to discredit you, claim you're a grieving widow who's lost perspective. They'll say you're motivated by money or revenge rather than justice. "Let them try," I replied. "I have something they don't expect: documentation and witnesses. And I'm not the only family they've wronged." That night, I created a private Facebook group for families affected by preventable medical errors at our hospital. Within a week, I had 15 members. Within a month, over 40 families had shared their stories of loss, cover-up, and institutional intimidation. We weren't isolated victims anymore. We were a community with a common cause, and together we were far more powerful than any of us had been alone. The hospital's pattern of covering up medical errors was about to be exposed, and this time, they wouldn't be able to silence all of us. The cease and desist letter arrived on a Tuesday morning, delivered by a courier who required my signature and identification. The law firm's letterhead was impressive, one of those white shoe legal practices that specialized in protecting corporate interests from inconvenient truths. The letter accused me of harassment of hospital staff, unauthorized access to confidential information, defamation of medical professionals, and interference with legitimate business operations. It demanded I immediately stop spreading false and malicious statements about the hospital and threatened both criminal prosecution and civil liability if I continued my campaign of harassment. The language was designed to intimidate, filled with legal jargon about tortious interference and intentional infliction of emotional distress. But buried in the threats was an offer, a settlement that would pay me $250,000 in exchange for signing a comprehensive non-disclosure agreement and ceasing all investigation into my husband's death. $250,000 to stay quiet about murder. I was still processing the letter when my phone rang. My supervisor Janet's voice was strained, professional in a way that meant she was reading from a script. "Katherine, I need you to come in this afternoon for a meeting with Human Resources. There have been some concerns raised about your conduct since returning from bereavement leave." The HR meeting was a masterclass in institutional intimidation. 3 administrators sat across from me in the stark conference room, their faces arranged in expressions of practiced concern. "Katherine, we understand you're still grieving, but several staff members have reported feeling uncomfortable with your recent behavior," the HR director began. "Questions about medical procedures, requests for information that's outside your department, attempts to discuss confidential patient matters." I kept my voice steady. "I'm trying to understand what happened to my husband. And we sympathize with that need for closure. But your position here gives you access to sensitive information, and we have to ensure that access isn't being misused. The hospital is prepared to offer you a generous severance package, 6 months' salary plus full benefits continuation, if you feel you need more time to heal away from this environment." Translation: take the money and disappear. "And if I don't accept this generous offer?" The three exchanged glances. "Then we'll need to discuss some concerning reports about your professional conduct. Accessing patient records outside your department's scope. Inappropriate contact with medical staff about matters unrelated to your job duties. These could potentially result in disciplinary action." They had me cornered, or thought they did. Accept their severance and lose my inside access to information, or fight and face termination for cause, which would destroy my professional reputation and eliminate any severance, but they'd miscalculated something important about my situation. I'd already gathered most of the evidence I needed, and I had allies outside the hospital now. More importantly, I had something that money couldn't buy: absolute moral clarity about what I was fighting for. "I need time to consider your offer," I said. That evening, the pressure campaign escalated. A police officer knocked on my door, explaining that the hospital had filed a complaint about suspicious activity in their parking lot. Someone matching my description had been seen loitering and approaching employees in an intimidating manner. No charges were filed, but the message was clear: they were building a case to paint me as unstable, obsessed, potentially dangerous. My car insurance company called the next day. Due to changed risk factors, my rates were increasing by 400%. When I protested, they explained that my employment status was under review and my driving record showed recent police contact. My bank called about my mortgage. Routine review had flagged some concerns about my employment stability. Perhaps I'd like to discuss refinancing options that would provide more flexibility during this difficult time. Every aspect of my life was being systematically targeted. The hospital's reach extended into the financial and legal systems that governed my daily existence. They were demonstrating their power to make my life impossible if I continued fighting them, but the final straw came when I received a call from my husband's life insurance company. They were reviewing his policy payout due to questions about the circumstances of his death. If those questions weren't resolved quickly, the payout might be delayed indefinitely. They were holding our financial future hostage to buy my silence. That night, I sat in our empty house, surrounded by legal threats and financial pressures, feeling the full weight of institutional power arrayed against me. They wanted me to believe I was powerless, that the system was too big and too connected for one grieving widow to challenge. But as I looked at the photos of my husband on our mantel, his trust, his belief in doing what was right, I realized they'd made a crucial mistake. Every threat, every pressure tactic, every attempt to silence me was evidence of their guilt. Innocent institutions don't need to destroy people who ask questions. I picked up my phone and called the investigative journalist. "I'm ready to go. On the record," I told her. "All of it. The cover-up, the threats, the systematic corruption. Let's make this as public as possible." The hospital wanted a war. They were about to get one. The encrypted USB drive arrived in my mailbox 3 days after my meeting with the journalist. No note, no identification, just a small device wrapped in newspaper. When I plugged it into my laptop, I found a treasure trove of information that took my breath away. Hundreds of files documented years of systematic cover-ups at the hospital. Email chains between administrators discussing damage control strategies. Financial records showing payments to families in exchange for silence. Personnel files showing employees who'd been terminated after reporting safety concerns, but most shocking were the recordings, audio files from internal meetings where hospital executives discussed treating patient deaths as cost-benefit analyses, rather than tragedies requiring accountability. My phone rang within an hour of opening the files. The voice was familiar but cautious. "Katherine, this is Rebecca. Don't say my name on the phone. Can you meet at the same place tonight?" At the coffee shop, Rebecca looked exhausted but determined. "Word is spreading through the hospital. People are talking about what you're doing, how you're fighting back. Some of the staff are scared, but others are angry. We've been watching this happen for years, feeling powerless to stop it." She slid a piece of paper across the table with 5 names written on it. "These people are ready to talk. Nurses, technicians, even one doctor who's been documenting problems for years. They have evidence, recordings, photographs of things the hospital doesn't want public." "Why now?" I asked. "What changed?" "Because someone finally stood up to them. Because you proved they can be challenged." She leaned forward. "Dr. Morrison called an all-staff meeting yesterday. He said there were disgruntled employees spreading false information about the hospital, and that anyone caught talking to unauthorized persons about internal matters would be immediately terminated. The fear tactics that had worked for years were backfiring. Instead of silence, they were creating solidarity among staff who'd witnessed too many preventable deaths and too many cover-ups." Over the next week, I met with each of the potential whistleblowers. Their stories painted a picture of institutional corruption that went far beyond what I'd imagined. Dr. Patricia Wells, an emergency room physician, had been documenting safety violations for 3 years. She'd repeatedly tried to report inadequate staffing, malfunctioning equipment, and dangerous shortcuts that administrators had implemented to cut costs. Her concerns were always dismissed as individual perspectives that didn't align with institutional data. "I became a doctor to save lives," she told me, "but I've watched this place kill people through negligence and greed. When they threatened to destroy my career for speaking up, I started keeping copies of everything." James Park, a senior surgical technician, had photographs of operating rooms with broken equipment that hadn't been repaired for months. He documented instances where surgeries proceeded despite safety concerns because canceling would have cost the hospital money. "Your husband wasn't the first wrong patient surgery," he revealed. "There was another case 2 years ago. A woman got the wrong procedure, survived, but suffered permanent complications. The hospital settled with her family for $2 million and made them sign NDAs. Maria Santos, a nurse in the cardiac unit, had recorded conversations with administrators who explicitly told staff to manage their documentation, to minimize legal liability rather than report actual problems to regulatory agencies." Each whistleblower had their own USB drive of evidence, their own documentation of systematic failures. Together, we were building a case that exposed not just individual medical errors, but institutional policies that prioritized profits over patient safety. But the hospital was fighting back. Rebecca called to warn me that Dr. Morrison was conducting loyalty interviews with staff, asking pointed questions about their commitment to the hospital and their contact with outside parties. Several employees had been placed on administrative leave pending investigation of their professional conduct. "They're trying to identify everyone who's talking to you," she said. "Some people are getting scared and backing out." The pressure was enormous. These were people with families, mortgages, professional licenses that could be threatened. Standing up to the hospital meant risking everything they'd worked for, but we also understood that staying silent meant more people would die. More families would lose loved ones to preventable errors. More cover-ups would protect an institution that had lost sight of its mission to heal. I organized our evidence into a comprehensive package: documents, recordings, photographs, witness statements, that painted an undeniable picture of systematic corruption. The hospital had created a culture where reporting problems was punished, where mistakes were hidden rather than corrected, where patient safety was secondary to financial considerations. When I delivered the package to the investigative journalist, she was stunned by the scope of what we'd uncovered. "Katherine, this isn't just a story about medical malpractice," she said. "This is about corporate fraud, conspiracy, and public safety. This could bring down the entire administration and force systematic reforms." We weren't just seeking justice for my husband anymore. We were fighting for every future patient who would be harmed by the hospital's culture of secrecy and profit over safety. the institution that had killed my husband through negligence and tried to silence me through intimidation, was about to face the full power of truth exposed to public scrutiny. The newspaper article that changed everything was published on a Sunday morning. The headline read, "Local hospital covered up patient deaths, falsified records, internal documents reveal." Below it was a photo of my husband and me from our wedding day, with the caption, "Katherine's husband died in wrong patient surgery hospital tried to hide." The journalist had done her work meticulously. The article laid out the evidence systematically, the altered medical records, the pattern of covered-up deaths, the systematic intimidation of staff who tried to report problems. Most damaging were the direct quotes from internal emails and recordings where hospital executives discussed treating patient deaths as public relations problems rather than tragedies requiring accountability. My phone started ringing before 8 a.m. Local news stations, radio shows, other newspapers, everyone wanted to interview the widow who'd taken on the hospital establishment and won. But along with media attention came the hospital's counterattack. By noon, the hospital had released a statement painting me as a grieving widow who has unfortunately been misled by disgruntled former employees with personal agendas. They claimed I was exploiting her tragedy to pursue financial gain, and that the newspaper had been manipulated by false and misleading information. Dr. Morrison appeared on the local evening news, his manner calm and authoritative. "We sympathize deeply with Mrs. Katherine's loss," he said, "but grief can sometimes cloud judgment. The incident involving her husband was thoroughly investigated and found to be an unfortunate but unavoidable surgical complication. These recent allegations are baseless and harmful to the dedicated medical professionals who serve our community." The hospital's public relations machine went into overdrive. They released statements from grateful patients, praising their care. They highlighted their awards and accreditations. They positioned themselves as victims of a malicious campaign by people who didn't understand the complexities of modern medicine, but the strategy backfired. The more aggressively they attacked my credibility, the more attention the story received. Other media outlets picked up the investigation, and each new article brought forward more families with similar stories. The local television station ran a week-long series called Medical Errors and Cover-Ups, a Pattern of Deception. Each night featured another family whose loved one had died from preventable errors that the hospital had hidden. The statistics I'd uncovered were presented in stark graphics that showed mortality rates far above national averages. Social media amplified everything. The hashtag Justice for Patients began trending locally, then regionally. People shared their own stories of medical errors, cover-ups, and institutional intimidation. What had started as one widow's fight for answers had become a movement. The hospital tried desperately to control the narrative. They hired a crisis management firm that specialized in protecting healthcare institutions from reputation attacks. Press releases emphasized their commitment to patient safety and their world-class medical care. But every public statement they made created new problems. When they claimed their mortality rates were within acceptable ranges, families of patients who died pointed out that their loved ones shouldn't have been acceptable statistics. When they insisted their internal investigation had been thorough, we released documents showing it had been designed to reach predetermined conclusions. The turning point came when Dr. Patricia Wells, the emergency room physician, agreed to go on camera. Her interview was devastating for the hospital. "I've worked at this institution for 8 years, she said, looking directly into the camera. "I've watched patient after patient suffer harm that could have been prevented if the hospital had prioritized safety over profits. When staff tried to report problems, we were told to keep quiet or find other jobs. Katherine's husband died because this institution has created a culture where admitting mistakes is more dangerous than letting patients die." Within 24 hours of that interview airing, the state health department announced they were launching a formal investigation into the hospital's patient safety practices. The medical board said they were reviewing the licenses of physicians involved in covered-up incidents. The district attorney's office indicated they were examining whether criminal charges were warranted for falsifying medical records, but the hospital wasn't finished fighting. They released my personnel file, highlighting every minor workplace issue from my 6 years of employment. They suggested I'd been unstable even before my husband's death and that my grief had pushed me over the edge into obsessive and delusional behavior. They hired investigators to dig into my personal life, looking for anything that could discredit my character. They reached out to my friends and family members, asking probing questions about my mental health and motivations. The attacks were vicious and personal, designed to destroy my credibility and make me an object of pity rather than respect. But they miscalculated the public's response. Instead of turning people against me, the hospital's aggressive tactics made them look cruel. And vindictive editorial pages across the state condemned the hospital's victim blaming and character assassination. Patients began canceling procedures and choosing other facilities. Staff morale plummeted as employees realized their employer would destroy anyone who threatened institutional interests. The media attention had transformed my personal tragedy into a public reckoning with healthcare accountability. The institution that had thought they could silence one grieving widow was now facing scrutiny from regulators, journalists, and the entire community they claimed to serve. Justice was finally within reach. The wrongful death lawsuit I filed against the hospital was unlike anything the local legal community had seen. Armed with documented evidence of cover-up and systematic corruption, my attorney approached the case not as typical medical malpractice, but as institutional fraud and conspiracy. The filing itself was devastating to read. 23 pages meticulously laid out how hospital staff had mixed up two patients, continued surgery despite realizing the error, falsified medical records to hide the mistake, and systematically intimidated witnesses to prevent the truth from emerging. But this was just the beginning. Within a week of filing, 3 other families contacted my lawyer wanting to join the lawsuit. Within a month, we had 12 families whose loved ones had died from preventable errors that the hospital had covered up. The case was rapidly becoming a class action lawsuit that would expose the full scope of institutional negligence. The hospital's legal team was formidable, a dozen attorneys from the state's most prestigious firm, specialists in defending healthcare institutions from liability claims. Their strategy was predictable: attack the credibility of witnesses, claim that complex medical decisions were being second-guessed by people without medical training, and argue that even if errors occurred, they fell within the acceptable range of complications inherent in medical practice. But they faced a problem they'd never encountered before. We had their own internal documents proving they knew about systematic problems and chose to hide them rather than fix them. The deposition phase was brutal for hospital administrators. Under oath, they were forced to explain email conversations about managing narratives and containing damage. Dr. Morrison struggled to justify why he'd ordered staff to alter medical records rather than report the error to regulatory agencies. "Doctor, this email shows you instructing staff to adjust documentation to reflect standard complications rather than procedural errors. Can you explain what you meant by that?" His answer was painful to watch. "We wanted to ensure accuracy in our reporting." Accuracy? Or did you want to hide the fact that you'd killed the wrong patient? The hospital's chief administrator fared even worse. When confronted with recordings of meetings where she discussed paying families to resolve concerns quietly, she claimed not to remember conversations that had occurred just months earlier. But the most powerful testimony came from our whistleblower witnesses. Rebecca, Dr. Wells, James, and Maria each took the stand to describe a culture where reporting safety problems was career suicide, where administrators explicitly instructed staff to prioritize hospital reputation over patient welfare. Dr. Wells's testimony was particularly devastating. "I was told repeatedly that my job was to treat patients, not to question hospital policies. When I documented safety violations, I was called into meetings where administrators suggested I might be happier working elsewhere. The message was clear: stay quiet or leave." The hospital's defense crumbled as more evidence emerged during discovery. Internal memos showed executives discussing which families were most likely to sue, and how much money it would take to buy their silence. Financial records revealed a pattern of settlement payments designed to prevent cases from going to trial where evidence might become public. Most damaging was the Protocols Committee we'd suspected existed, a secret group of administrators and lawyers who met monthly to decide how to handle problematic cases. Meeting minutes showed them discussing my husband's death just hours after it occurred, already planning the cover-up strategy. The hospital tried to settle multiple times, offering increasingly large sums to make the case disappear. First $2 million, then $5, then $10 million split among all the plaintiff families. Each offer came with comprehensive non-disclosure agreements that would have sealed all evidence and prevented any public accountability. I refused every offer. This had never been about money, it was about ensuring no other family would face what we'd endured. The trial itself drew national media attention. Courthouse steps were lined with cameras every day as families of victims, hospital employees, and community members came to witness what many called a reckoning with healthcare accountability. My testimony was the emotional centerpiece of the plaintiff's case. I described kissing my husband goodbye for routine surgery, my confidence in the hospital where I worked, and the devastating moment when I realized he died not from complications, but from an error that could have been prevented and corrected. They didn't just kill my husband through negligence, I told the jury. They made a conscious choice to let him die rather than admit their mistake. Then they tried to bury the truth along with his body. The defense's closing argument attempted to portray the plaintiffs as people seeking to profit from tragedy, claiming that regrettable outcomes in medicine were being unfairly characterized as institutional conspiracy. They argued that holding hospitals liable for every adverse outcome would destroy healthcare as we knew it, but our closing was devastating. My attorney displayed the evidence systematically, the altered records, the cover-up emails, the pattern of hidden deaths, the systematic intimidation of witnesses. He concluded with a simple question: how many more patients must die in preventable accidents before this institution prioritizes safety over profits? After 3 days of deliberation, the jury returned with a verdict that sent shockwaves through the healthcare industry. Guilty on all counts of wrongful death, fraud, conspiracy, and intentional infliction of emotional distress. Total damages, $47 million across all plaintiff families, but more important than the monetary award was the judge's order for comprehensive institutional reform, including independent oversight of patient safety, mandatory reporting of all adverse events, and criminal referral for executives who'd participated in the cover-up. As I left the courthouse that day, surrounded by other families who'd finally received justice, I felt my husband's presence. His death had exposed a system of corruption that had killed dozens of patients and would have killed dozens more. His life, cut short by institutional indifference, had become the catalyst for changes that would save countless others. The email chain that emerged during the trial's discovery phase revealed the true scope of the conspiracy I'd uncovered. These weren't isolated incidents of poor judgment, they were part of a systematic corporate strategy to hide medical errors and maximize profits regardless of human cost. The email thread started just 2 hours after my husband's death, with a message from the hospital's chief legal counsel to the entire executive team: Code Red situation in ORF 3. Implementing Protocol 7 immediately. All department heads report to boardroom for damage assessment. Protocol 7, it turned out, was the hospital's internal code for covering up medical errors that could result in significant liability. The protocol had been developed by a consulting firm that specialized in risk management for healthcare corporations, a euphemism for teaching hospitals how to hide mistakes from patients, families, and regulators. The consulting firm's manual, obtained through discovery, was a blueprint for institutional corruption. It outlined specific steps for altering medical records, coaching staff on appropriate responses to investigations, and identifying which families were most likely to accept settlements versus those who might pursue legal action. Most chilling was the cost-benefit analysis section, which provided formulas for calculating whether it was cheaper to settle a case quietly or fight it publicly. The manual explicitly stated that reputation management often requires accepting short-term financial costs to prevent long-term institutional damage. My husband's case was analyzed using these formulas within hours of his death. An email from the hospital's chief financial officer laid out the calculation: estimated settlement cost for wrongful death, $2 to $3 million. Estimated cost of public trial and regulatory action, $15 to $20 million. Recommend immediate implementation of containment strategy. The containment strategy involved everything I'd experienced, isolating me from potential allies, restricting my access to information, offering financial incentives for silence, and preparing to destroy my credibility if I refused to cooperate. But the conspiracy went far beyond my individual case. The email chain revealed that Protocol 7 had been implemented 43 times in the past 5 years. 43 families had lost loved ones to preventable medical errors that the hospital had systematically covered up. The executives discussed these deaths with cold corporate efficiency. A cardiac surgery error that killed a 34-year-old father was described as manageable with standard narrative adjustments. A medication error that killed an elderly woman was categorized as low-risk case, family unlikely to pursue legal action. Each death was treated as a business problem to be solved rather than a human tragedy requiring accountability and prevention. The hospital's board of directors was fully aware of these practices. Board meeting minutes showed regular reports on risk management activities and reputation protection measures. When one board member questioned whether these practices were ethical, the hospital's CEO assured him that industry standards support these approaches to complex liability situations. Industry standards. This wasn't one rogue hospital. This was a systematic approach being used by healthcare corporations across the country. The most damning evidence came from the hospital's annual reports to its corporate parent company. These documents, never intended for public view, boasted about the hospital's success in minimizing liability exposure and maintaining positive community relations despite challenging operational circumstances. The corporate parent company, a massive healthcare conglomerate, had implemented these practices across dozens of hospitals in multiple states. Internal communications showed executives sharing best practices for covering up medical errors and comparing statistics on how successfully each facility had hidden patient deaths from public scrutiny. My husband hadn't died from an isolated medical error. He died because healthcare had become a corporate enterprise where patient safety was secondary to profit protection. The conspiracy I'd uncovered involved not just local administrators, but a national network of executives who turned hiding medical mistakes into a science. The revelation transformed our lawsuit from a local case about medical malpractice into a federal investigation of healthcare fraud. The FBI opened an investigation into the consulting firm that had developed Protocol 7. The Department of Health and Human Services launched audits of hospitals owned by the parent corporation. Congressional committees announced hearings on systematic cover-ups of medical errors, but perhaps most importantly, the exposure of this conspiracy gave voice to hundreds of families across the country who'd lost loved ones to preventable medical errors and been told there was nothing they could do about it. As I read through email after email discussing my husband's death in terms of liability management and cost-benefit analysis, I felt a rage deeper than anything I'd experienced during my fight for justice. These people had looked at his death, our love, our life together, our shattered future, and seen only a business problem to be solved. They'd underestimated the power of one person who refused to be silent. Now their entire system of corruption was collapsing under the weight of truth they'd tried so hard to bury. The termination letter arrived on a Friday afternoon, delivered personally by a security guard who waited while I cleaned out my desk. After 6 years of serving families in crisis, my career at the hospital ended with a cardboard box and an escort to the parking lot. The official reason was violation of confidentiality policies and inappropriate use of institutional resources. The real reason was that I'd refused to be silenced about my husband's death and the systematic corruption I'd uncovered. Walking out of that building for the last time, carrying my personal belongings past colleagues who avoided eye contact, I felt the full weight of what fighting for truth had cost me. My income was gone. My health insurance was terminated. My professional references were tainted by the hospital's claims of misconduct, but the personal costs went far deeper than employment. Friends who worked at the hospital stopped returning my calls. Neighbors who'd brought casseroles after my husband's death now crossed the street to avoid conversations. The community that had once supported me now seemed divided between those who admired my courage and those who saw me as a troublemaker who'd attacked a respected institution. My sister called that weekend, her voice carefully neutral. "Katherine, maybe it's time to move on. You've made your point. You've gotten justice. But this obsession with the hospital, it's not healthy. It's not what he would have wanted. The word obsession stung because part of me wondered if it was true. Had my fight for justice become an unhealthy fixation that was preventing me from grieving and healing? Was I destroying my future to prosecute the past? The financial pressure was relentless. Legal fees had consumed most of our savings. The mortgage payments on our house, the home my husband and I had planned to grow old in, were becoming impossible to manage on unemployment benefits. The life insurance payout that should have provided security was still tied up in the company's investigation of the circumstances surrounding his death. I applied for social work positions at other hospitals, but somehow word of my difficult history had spread through the professional network. Interviews that started positively ended abruptly when administrators realized who I was. One potential employer was honest enough to tell me directly, "Katherine, your qualifications are excellent, but hiring you would create complications with our relationship with other healthcare institutions." I was being blacklisted from the profession I loved because I'd sought truth about my husband's death. The emotional toll was equally devastating. Fighting the hospital had given me purpose, a way to channel my grief into action. But now, in the quiet moments between legal proceedings and media interviews, the reality of my loss crashed over me in waves. My husband was still dead. No amount of justice would bring him back. No institutional reforms would give me back the future we'd planned together. I was winning a public battle while losing the private war against despair. Some nights I sat in our bedroom, surrounded by boxes of legal documents and evidence files, wondering if I'd traded my husband's memory for a crusade that had consumed my life. The house felt like a museum of our interrupted life, his coffee cup still in the sink, his clothes still in the closet, his books still bookmarked at pages he'd never finish reading. But then I'd receive messages from other families whose loved ones had died from preventable medical errors. Letters from hospital employees who said my courage had inspired them to speak up about safety problems. Emails from medical students who promised to remember my husband's story as they began their careers. One message came from a woman whose father had died in surgery 2 years before my husband. She'd been told it was an unavoidable complication, and she'd accepted that explanation until my case revealed the pattern of covered-up deaths. "Katherine, because of your fight, I finally understand what really happened to my father. I can't get him back, but I can stop feeling guilty that I didn't do enough to save him. You've given me peace I didn't know I was missing." The legal aid organization that had helped with my case offered me a position as a patient advocate, lower pay than my hospital job, but meaningful work helping families navigate medical crises and fight institutional negligence. It wasn't the career I'd planned, but it was a way to honor my husband's memory while rebuilding my professional life. The house became too expensive to maintain, so I sold it and moved to a small apartment across town. Packing up our life together was heartbreaking, but it was also liberating. I was finally letting go of the physical reminders of what I'd lost and focusing on what I could still build. As I folded my husband's clothes for donation, I found a note in his jacket pocket, a grocery list in his handwriting that included "flowers for Katherine" at the bottom. Such a small thing, but it reminded me that he'd loved me not for my ability to seek justice or reform institutions, but for who I was as a person. The fight for accountability was important, but it couldn't become my entire identity. I needed to find a way to honor his memory while also creating space for healing, for new relationships, for a future that he would have wanted me to have. The hospital had tried to silence me with threats and intimidation. They'd failed. But the greater challenge was learning how to live with purpose and hope after the justice was won and the cameras were gone. The petition started small, just a few families who'd lost loved ones to preventable medical errors, demanding accountability and reform at the hospital. But as word spread through social media and local news coverage, it grew into something unprecedented. Within 2 weeks, we had 1,000 signatures. Within a month, over 5,000 people had signed, demanding that the hospital implement comprehensive patient safety reforms and submit to independent oversight. The signers weren't just family members of victims, they were community members who realized that patient safety affected everyone. The petition became a rallying point for people who'd felt powerless in the face of institutional authority. Nurses from other hospitals signed, sharing their own stories of being silenced when they tried to report safety problems. Patients who'd experienced medical errors but been told to be grateful they survived found their voices through our growing movement. Local churches began hosting support meetings for families affected by medical malpractice. These weren't just grieving sessions, they were organizing meetings where people shared information about their experiences and strategized about how to push for systematic changes. The fundraising efforts started organically. A neighbor who'd watched my fight from the beginning set up a crowdfunding page to help with my legal expenses. She wrote, "Katherine lost her job for seeking truth about her husband's death. If we believe in justice, we need to support people brave enough to fight for it." The response was overwhelming. Small donations of $10 and $20 came from hundreds of people, teachers, mechanics, retirees, students, who saw my case as bigger than one family's tragedy. The money helped cover legal fees, but more importantly, it showed that I wasn't alone in this fight. A group of retired nurses formed advocates for patient safety and began attending every hospital board meeting, asking pointed questions about mortality rates, error reporting, and oversight procedures. The hospital couldn't dismiss them as disgruntled employees or grief-stricken family members. These were respected healthcare professionals demanding accountability. The local medical school organized a symposium on patient safety and medical ethics, using my husband's case as a central example of how institutional culture could prioritize reputation over human life. Students packed the auditorium, asking tough questions about how to maintain moral integrity in systems that pressured them to stay silent about problems, but the most powerful support came from other families who'd experienced similar losses. What had started as isolated tragedies became a community of people united by their determination to prevent others from suffering as they had. Jenny Rodriguez, who'd lost her mother to a medication error, became our most effective spokesperson. Her calm, articulate presentations to regulatory agencies and community groups helped people understand that this wasn't about vengeful families seeking money, it was about preventing future deaths. Thomas Blake, whose father had died during routine surgery, used his background in accounting to analyze the hospital's financial records and expose how much money they spent on legal fees and settlements compared to patient safety improvements. Together, we created a network that could do what no individual family could accomplish alone. Sustained pressure for institutional change. The hospital tried to counter our grassroots organizing with their own public relations campaign. They organized press conferences featuring grateful patients and loyal employees. They highlighted their charitable work and community contributions. They positioned themselves as victims of an unfair attack by people who didn't understand the complexities of modern medicine, but their corporate messaging couldn't compete with authentic stories from real families. When they claimed their safety record was exemplary, we presented documented evidence of covered-up deaths. When they insisted their staff supported hospital policies, current employees anonymously shared stories of being intimidated into silence. The community demonstrations grew larger each week. What started as a dozen people holding signs outside the hospital became hundreds of community members demanding accountability. The local media covered each event, giving families opportunities to share their stories and explain why institutional reform mattered to everyone. The hospital's reputation in the community began to crumble. Patients started choosing other facilities for non-emergency procedures. Doctors began referring complex cases to hospitals with better safety records. Medical residents ranked the hospital lower on their preference lists. Most significantly, the community pressure forced local politicians to take action. The mayor called for an independent review of hospital practices. The city council passed a resolution supporting families of medical error victims. The state representatives from our district introduced legislation requiring hospitals to report all adverse events to a public database. The petition that had started with a few signatures became a mandate for change that politicians and hospital administrators couldn't ignore. But more than the numbers, it represented a fundamental shift in how the community viewed healthcare accountability. For years, people had accepted that medical errors were inevitable and that questioning healthcare institutions was inappropriate. Our movement showed that patients and families had both the right and the responsibility to demand transparency and safety from the institutions they trusted with their lives. The support wasn't universal. some community members still saw us as troublemakers attacking a respected institution. But a critical mass of people had come to understand that holding hospitals accountable wasn't anti-medical, it was pro-patient. As I stood before a crowd of supporters at our largest rally, looking out at hundreds of faces united in demanding justice and reform, I realized that my husband's death had sparked something far bigger than I'd ever imagined. We weren't just seeking accountability for past mistakes, we were building a movement that would protect future patients and their families. The courtroom was packed beyond capacity on the first day of trial. Media representatives filled the gallery alongside family members of medical error victims, hospital employees who'd found the courage to speak out, and community members who'd followed our fight from the beginning. Judge Patricia Chen, known for her no-nonsense approach to complex litigation, had agreed to allow cameras in the courtroom, a decision that would broadcast our pursuit of justice to audiences far beyond our community. The hospital's legal team entered with military precision, 12 attorneys in expensive suits, carrying bankers' boxes of documents meant to overwhelm and intimidate. Their lead counsel was Thomas Hart, a legendary defense attorney who specialized in protecting healthcare institutions from liability. His opening statement was a masterclass in misdirection. "Ladies and gentlemen of the jury, this case is about the dangerous precedent of Monday morning quarterbacking in medicine," Hart began. "Mrs. Katherine has suffered a terrible loss, and our hearts go out to her. But grief, no matter how justified, cannot be allowed to criminalize the split-second decisions that healthcare professionals must make in life-and-death situations." He painted my husband's death as a tragic but inevitable outcome of complex medical care, emphasizing the heroic efforts of staff who'd tried to save him. He characterized the evidence of cover-up as routine quality assurance procedures that had been misinterpreted by people without medical training. But our attorney, Sarah Martinez, delivered an opening that cut through the hospital's spin with surgical precision. "This case is not about the inevitable risks of medical care," she told the jury. "This case is about what happens when an institution values its reputation more than human life. The evidence will show that hospital staff mixed up two patients, realized their mistake during surgery, and chose to continue operating rather than admit their error. Then they systematically falsified records and intimidated witnesses to hide what they'd done." The first week of testimony established the basic facts of the case. Medical experts explained how the patient mix-up had occurred and why continuing the surgery after realizing the error was a catastrophic decision. The jury saw the original wristbands, the altered medical records, and the email chains documenting the cover-up strategy. But the real drama began when our whistleblower witnesses took the stand. Rebecca, the nurse who'd first whispered the truth to me, testified about the emergency meeting where staff were told to stay silent about the error. Her voice shook as she described Dr. Morrison's words, "If this gets out, we could lose our accreditation. People will lose their jobs." Sometimes protecting the institution means protecting the greater good. The hospital's attorneys tried to discredit her, suggesting she was a disgruntled employee with personal grievances against management. But Rebecca remained composed, answering each attack with quiet dignity. Dr. Patricia Wells's testimony was devastating for the hospital. As an emergency room physician with an impeccable reputation, she couldn't be dismissed as unreliable or vindictive. Her methodical presentation of safety violations she'd documented over 3 years painted a picture of an institution that consistently prioritized profits over patient welfare. "I became a doctor to save lives," she said, looking directly at the jury. "But I watched this hospital kill patients through negligence and then hide those deaths to protect its reputation." Katherine's husband died because the hospital had created a culture where admitting mistakes was more dangerous than letting patients die. The hospital's defense crumbled during cross-examination of their own witnesses. Dr. Morrison, confronted with his own emails about managing narratives and containing damage, appeared evasive and dishonest. When asked why he'd ordered medical records to be altered, he claimed he was ensuring accuracy, but couldn't explain why accurate records would need to describe a brain tumor surgery for a patient who'd been admitted for gallbladder removal. The hospital administrator's testimony was even worse. Faced with recordings of meetings where she discussed patient deaths as reputation management challenges, she claimed not to remember conversations that had occurred just months earlier. But the most powerful moment came when I took the stand to describe that horrible day when my husband died. I kissed him goodbye that morning with complete confidence, I told the jury, my voice steady despite the tears in my eyes. I worked at this hospital. I trusted these people with my life, with his life. But they didn't just make a mistake, they made a choice. When they realized they had the wrong patient, they chose to continue the surgery rather than admit their error. Then they chose to lie about what happened rather than take responsibility. The hospital's attorney tried to suggest that my grief had distorted my perception of events, that I was seeking someone to blame for an unavoidable tragedy. But I was ready for that attack. Mr. Hart, I've spent my entire career helping families deal with medical crises. I understand that sometimes people die despite everyone's best efforts. But this wasn't one of those times. This was negligence, followed by fraud, followed by a systematic attempt to silence anyone who tried to tell the truth. The jury deliberated for 3 days. Each day of waiting felt like an eternity, wondering if months of fighting and sacrifice would be vindicated or if the hospital's resources and reputation would ultimately prevail. When the jury filed back into the courtroom, their faces were grim but determined. The forewoman, a retired teacher, stood to read the verdict. In the matter of Katherine versus Regional Medical Center, we find the defendants liable for wrongful death, medical malpractice, fraud, conspiracy, and intentional infliction of emotional distress. The monetary damages, $47 million across all plaintiff families, sent shockwaves through the healthcare industry. But more important was the judge's order for comprehensive institutional reform and criminal referral for executives who'd participated in the cover-up. As I left the courthouse that day, surrounded by other families who'd finally received justice, I felt my husband's presence more strongly than I had since the day he died. His death had exposed a system of corruption that had killed dozens of patients and would have killed dozens more. His life, cut short by institutional indifference, had become the catalyst for changes that would save countless others. The verdict was more than justice, it was validation that one person's refusal to stay silent could indeed change the world. The new patient safety manual that emerged from our legal victory was a radical departure from everything the hospital had practiced before. Gone were the policies that prioritized institutional protection over patient welfare. In their place was a comprehensive system designed to prevent errors, report problems honestly, and learn from mistakes rather than hide them. The manual, running over 200 pages, established protocols that seemed revolutionary but should have been standard practice. All along, every adverse event, no matter how minor, had to be reported within 24 hours to both internal quality committees and external regulatory agencies. Patient identification procedures were tripled, with multiple verification steps before any procedure could begin. Most importantly, staff were not only permitted but required to speak up about safety concerns without fear of retaliation. I was invited to participate in developing these new protocols, working alongside the independent patient safety consultant who'd been appointed by the court to oversee the hospital's transformation. It was surreal to walk the halls where I'd once worked, now returning as an advocate for systematic change rather than an employee who could be silenced. The resistance to reform was immediate and predictable. Some longtime staff resented the additional paperwork and oversight procedures. A few department heads quietly questioned whether the new policies would slow down care and reduce efficiency. But the hospital's new administration, brought in to replace executives who'd been terminated for their role in the cover-up, made it clear that patient safety was now the absolute priority. Dr. Susan Walsh, the new chief medical officer, had been recruited specifically for her expertise in transforming healthcare institutions with poor safety records. Her first all-staff meeting was blunt and uncompromising. The culture that led to preventable patient deaths ends today, she announced to the packed auditorium. If you're uncomfortable with transparency, accountability, and putting patient safety above all other considerations, this is not the place for you anymore. The changes were dramatic and visible. Error reporting increased by 400% in the first 6 months, not because more errors were occurring, but because staff were finally reporting problems that had been hidden for years. The hospital's mortality rates dropped to below state averages. As systematic problems were identified and corrected, other hospitals across the state began voluntarily adopting similar reforms, recognizing that the legal and reputational costs of hiding medical errors far outweighed the temporary discomfort of transparency. The consulting firm that had developed the cover-up protocols we'd exposed was investigated by multiple state agencies and eventually dissolved, but the most significant changes went beyond policy manuals and reporting procedures. The hospital created a patient and family advisory council with real authority to review safety practices and recommend improvements. Families of medical error victims were given permanent seats on the council, ensuring that the human cost of negligence would never again be forgotten. A memorial garden was installed on the hospital grounds, honoring patients who died from preventable medical errors. My husband's name was inscribed on the central monument, along with the names of the other victims our investigation had uncovered. The garden served as a daily reminder to staff that behind every safety protocol was a human life that mattered. The hospital's new transparency policies extended to public reporting of all adverse events, mortality statistics, and safety improvement measures. What had once been hidden from patients and families was now posted on the hospital's website and updated monthly. The radical concept of honest communication with the community transformed the institution's relationship with the people it served. Medical schools across the region began using our case as a teaching example of how institutional culture could either promote or prevent patient safety. My husband's story became part of medical ethics curricula, helping train a new generation of healthcare providers who understood their obligation to prioritize patient welfare over institutional loyalty. The regulatory agencies that had once accepted the hospital's superficial compliance reports now conducted surprise inspections and demanded documentation of all safety improvement measures. The oversight was intensive, but it ensured that the reforms weren't just cosmetic changes designed to weather negative publicity. Most importantly, the hospital established an Office of Patient Advocacy, staffed by professionals with backgrounds in social work and healthcare quality improvement. These advocates work directly with patients and families to navigate complex medical situations, ask difficult questions, and ensure that concerns were addressed promptly and honestly. I was offered the position of Director of Patient Advocacy, a role that would have brought my professional life full circle. After careful consideration, I accepted, understanding that this work was how I could best honor my husband's memory while ensuring that no other family would experience what we had endured. The office became a model for patient advocacy programs at hospitals nationwide. We published annual reports documenting how we'd helped families navigate medical crises, resolved complaints about care quality, and identified systematic problems before they could harm patients. But perhaps the most meaningful change was cultural. The hospital staff began to understand that admitting mistakes wasn't a sign of weakness, it was a demonstration of professional integrity. Nurses who identified potential problems were praised rather than punished. Doctors who acknowledged errors were supported in learning from them rather than hidden from accountability. 2 years after the trial, the hospital's patient satisfaction scores were the highest in the state. More importantly, preventable mortality rates had dropped by over 60%. The systematic reforms that had emerged from my husband's death were saving dozens of lives every year. As I walked through the memorial garden during my lunch break, reading the names of patients who died from preventable errors, I felt a profound sense of purpose. The institution that had killed my husband through negligence and tried to silence me through intimidation had been transformed into a model of patient safety and transparency. Change was possible, even in systems that seemed impossibly corrupt. But it required people willing to speak truth to power, even when the personal cost was devastating. The memorial plaque was unveiled on a crisp autumn morning, exactly 3 years after my husband's death. The bronze inscription in the hospital lobby read, "In memory of patients whose preventable deaths led to systematic reforms that save lives." Today, their legacy lives in our commitment to transparency, accountability, and the sacred trust between healer and patient. Standing in that lobby, surrounded by families of other victims and hospital staff who'd supported our fight for reform, I felt a complex mix of emotions. Grief for the husband I'd lost, pride in the changes we'd achieved, and hope for the future patients who would receive safer care because of our struggle. The patient safety foundation that I'd established in my husband's memory had grown beyond anything I'd imagined. What started as a small organization focused on our local hospital had become a national resource for families dealing with medical errors and healthcare institutions seeking to improve their safety culture. We'd helped families in 12 states navigate the complex process of seeking accountability for preventable medical errors. More importantly, we'd worked with hospitals, medical schools, and regulatory agencies to implement systematic reforms that prioritized patient safety over institutional protection. The Foundation's annual conference drew healthcare professionals from across the country who wanted to learn from our experience. Seeing doctors, nurses, and administrators honestly confronting the cultural problems that led to preventable deaths gave me hope that the changes we'd fought for were spreading far beyond our community. My personal healing had been slower and more complicated than the institutional reforms. For months after the trial, I'd struggled with depression and a sense of purposelessness. The adrenaline of fighting for justice had carried me through the darkest period of grief, but once that battle was won, I had to face the reality of rebuilding a life without my husband. Therapy helped me understand that seeking justice hadn't been a way of avoiding grief, it had been my way of honoring love. Every document I'd gathered, every witness I'd interviewed, every day I'd spent fighting the hospital's cover-up had been an expression of the love I felt for my husband and my refusal to let his death be meaningless. But healing also meant learning to imagine a future that wasn't defined entirely by his absence. Slowly, carefully, I began to rebuild relationships with friends and family members who'd supported me through the legal battle. I started dating again, something that felt impossible for years but gradually became a source of joy rather than guilt. The house I'd shared with my husband had been sold during the legal proceedings, but I'd kept his wedding ring, some photographs, and a few books that he'd loved. These weren't shrines to the past, they were reminders of love that continued to shape who I was becoming. The most meaningful reconciliation came with some of my former colleagues at the hospital. Rebecca, the nurse who'd first told me the truth, had become one of my closest friends. Dr. Wells had joined the Foundation's board of directors. Even some staff members who'd initially opposed our efforts had come to understand that patient safety reforms protected them as much as they protected patients. "Katherine, I need to apologize," said Janet, my former supervisor, when she approached me at the memorial service. "I was wrong to try to convince you to stay quiet. I was scared of losing my job, but you were fighting for something much more important than any of us realized." The Foundation's work had evolved beyond crisis response to prevention and education. We developed training programs for healthcare workers on speaking up about safety concerns. We'd created resources for patients and families about their rights to transparency and accountability. We'd worked with legislators to strengthen laws requiring honest reporting of medical errors, but perhaps most importantly, we'd changed the conversation about medical mistakes from shame and secrecy to learning and improvement. Hospitals that had once hidden their problems were now sharing their safety challenges and collaborating on solutions. The speaking engagements had become a significant part of my new life. Medical conferences, patient advocacy groups, and healthcare policy forums invited me to share the lessons learned from our fight for justice. Each speech was emotionally difficult, but it was also an opportunity to prevent other families from experiencing what we'd endured. After one particularly powerful presentation at a national patient safety conference, a young medical student approached me with tears in her eyes. "Mrs. Katherine, your husband's story will be with me throughout my entire career. I promise you that I'll never stay silent about safety problems, no matter what pressure I face." Those moments made everything worthwhile: the legal battles, the personal attacks, the financial struggles, the years of fighting institutional power. My husband's death was becoming a catalyst for cultural change that would protect countless future patients. As I stood in the memorial garden that evening, watching the sunset reflect off the plaques honoring patients who died from preventable errors, I felt his presence more clearly than I had in months. Not the desperate longing for someone who was gone, but the quiet companionship of someone whose love continued to guide my work. The legacy we'd built together wasn't just about exposing corruption or winning legal victories. It was about the fundamental principle that every patient deserved to trust that the healthcare system would prioritize their welfare above all other considerations. That trust, broken by institutional negligence and restored through our fight for transparency, had become the foundation for everything we'd accomplished and everything we hoped to achieve. The foundation charter was signed on a bright spring morning 5 years after my husband's death. The legal document establishing the Patient Advocacy and Safety Foundation as a permanent organization represented far more than bureaucratic paperwork. It was a promise that the lessons learned from our tragedy would continue protecting patients for generations to come. The Foundation's mission statement, which I'd drafted while sitting in the memorial garden, captured everything we'd fought to achieve: to ensure that no family experiences preventable loss due to medical errors that could have been prevented through transparency, accountability, and systematic commitment to patient safety over institutional protection. Our impact had grown beyond anything I could have imagined during those dark early days of fighting for truth about my husband's death. The foundation now operated in 18 states, had helped over 300 families navigate medical error cases, and had worked with 47 hospitals to implement comprehensive safety reforms. The data spoke for itself. Hospitals that had adopted our patient safety protocols showed 40% reductions in preventable mortality rates. Medical schools that incorporated our case study into their ethics curricula graduated students who were 60% more likely to report safety concerns during their residencies. Healthcare systems that had implemented our transparency policies experienced improved patient satisfaction scores and reduced liability costs, but the numbers, impressive as they were, only told part of the story. The real victory was cultural. Healthcare institutions were finally beginning to understand that hiding mistakes was more dangerous than admitting them. My role as the foundation's director had evolved into something I'd never expected but was perfectly suited for. Drawing on my social work background, my insider knowledge of how hospitals operated, and my hard-won expertise in healthcare advocacy, I'd become a bridge between families seeking justice and institutions seeking meaningful reform. The foundation's headquarters, located in a renovated building near the courthouse where we'd won our landmark victory, had become a pilgrimage site for families dealing with medical errors. Every week, people traveled from across the country to share their stories, seek guidance, and find the support they needed to fight for accountability. One of the most meaningful aspects of our work was the mentorship program we'd established for other families. Parents who'd lost children to preventable medical errors, spouses who'd become widows through institutional negligence, and adult children who'd watched their parents die from covered-up mistakes, all found community and purpose in helping others navigate similar tragedies. The Foundation's educational initiatives had transformed how healthcare professionals understood their obligations to patients and families. Our annual conference, now in its 5th year, attracted over 2,000 attendees from across the healthcare spectrum. Medical students, experienced physicians, hospital administrators, and patient advocates came together to learn from each other and commit to cultures of safety and transparency. But perhaps the most significant change was in my own life. The woman who'd kissed her husband goodbye for routine surgery and watched him die from a preventable error had become someone who helped others find strength in their darkest moments and channels their grief into meaningful action. The relationship I developed with Robert, a patient safety consultant who'd worked with us on hospital reforms, had grown slowly and carefully. He understood that my husband would always be part of who I was, that the foundation's work would always be central to my identity. Our love was built not on forgetting the past, but on honoring it while creating something new together. Our wedding, a small ceremony in the memorial garden, felt like a celebration of life's resilience rather than a replacement for what I'd lost. My husband's wedding ring, which I'd worn on a chain around my neck for 5 years, was buried beneath the tree we planted in his memory. The Foundation's latest initiative, a national database of medical errors and safety improvements, represented the culmination of everything we'd fought to achieve. For the first time, families could access comprehensive information about hospital safety records, and healthcare institutions could learn from each other's mistakes rather than hiding them. The database, funded by a coalition of patient advocacy groups, medical societies, and reform-minded healthcare systems, made transparent the information that hospitals had spent millions of dollars trying to keep secret. Mortality rates, error reports, safety violations, and improvement measures were all available to patients making decisions about their healthcare. As I reviewed the Foundation's annual report, documenting another year of lives saved through safety, reforms and families helped through their darkest moments, I thought about the journey that had brought me to this point. 5 years ago, I'd been a hospital social worker who believed in the inherent goodness of the healthcare system. My husband's death had shattered that faith, but the fight for justice had rebuilt it on a foundation of transparency and accountability rather than blind trust. The institution that had killed my husband through negligence and tried to silence me through intimidation had been transformed into a model of patient safety. The cover-up strategies that had hidden dozens of preventable deaths had been exposed and eliminated. The culture of secrecy that had protected institutional interests over patient welfare had been replaced by policies that prioritized truth and continuous improvement. But more than institutional change, I discovered something powerful about human resilience and the possibility of creating meaning from tragedy. My husband's death, as devastating as it was, had become a catalyst for changes that had saved hundreds of lives and would continue saving lives for decades to come. Standing in the Foundation's offices, surrounded by thank you letters from families we'd helped and testimonials from healthcare workers who'd found the courage to speak up about safety problems, I felt the profound satisfaction of purpose fulfilled. My husband had trusted the healthcare system with his life, and that trust had been betrayed. But through our fight for justice and systematic reform, we'd helped restore the sacred covenant between patients and healers, a covenant based on transparency, accountability, and the unwavering commitment to do no harm. If you're facing a similar struggle, if you've lost someone to preventable medical errors or witnessed institutional cover-ups, remember that change is possible. One person's refusal to stay silent can indeed transform systems that seem impossibly powerful. Like and subscribe to stay connected with stories of resilience, justice, and the power of ordinary people to create extraordinary change. Your voice matters, your truth has power, and your fight for justice can become someone else's foundation for hope.